Welcome. Today we delve into the world of healthcare, specifically Medicare Advantage and Medicare Supplement. To start, let's first understand what these terms mean. Medicare Advantage, also known as Part C, is an all-in-one alternative to original Medicare. It's a plan offered by private insurance companies approved by Medicare and often includes prescription drug coverage and additional benefits like dental and vision care. On the other hand, Medicare Supplement, also known as Medigap, is insurance that you buy from a private company that pays for some of the costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Both Medicare Advantage and Medicare Supplement serve to ensure that seniors have access to affordable health care. They play a crucial role in managing healthcare costs and providing financial security. Now that we know what these terms mean, it's time to look at them side by side. One of the most important factors when choosing a plan is cost. Let's compare the two. When it comes to Medicare Advantage and Medicare Supplement, understanding the costs associated with each can help you make an informed decision. First, let's dive into Medicare Advantage. With this plan, you'll typically pay a monthly premium. This may be low or sometimes even zero, but remember, you still have to pay your Medicare Part B premium. Also, Medicare Advantage plans usually have a yearly deductible for medical services, and some may have one for prescription drugs. Additionally, these plans have a maximum limit on your out-of-pocket costs each year, which can provide some financial security. Now, let's shift gears to Medicare Supplement, also known as Medigap. These plans come with a monthly premium that tends to be higher than Medicare Advantage premiums. However, they often cover many of the costs not covered by original Medicare, such as co-insurance and deductibles. This means, while your monthly cost may be higher, your out-of-pocket costs when you need medical care could be lower. Unlike Medicare Advantage, there is no maximum out-of-pocket limit with Medigap plans. In terms of cost comparison, Medicare Advantage often appears less expensive upfront due to lower or even zero monthly premiums. But keep in mind, these plans come with cost sharing when you use medical services. On the other hand, Medicare Supplement may have higher monthly premiums but provide more predictable costs, as many out-of-pocket expenses are covered. Another key difference is that with Medicare Advantage, costs can vary depending on the plan provider, while Medicare Supplement costs are standardized by the government, with the only variance being the private insurance company you choose. Clearly, the costs associated with each plan can vary greatly. Moving on, we will discuss the coverage each plan provides. Scene script. Coverage is another crucial factor when choosing a healthcare plan. How do our two contenders stack up? Let's first look at Medicare Advantage. When you opt for this plan, you get the same coverage as original Medicare, which includes Part A, hospital insurance, and Part B, medical insurance. But there's a bonus. Medicare Advantage plans often come with extra benefits that original Medicare doesn't cover. These could include prescription drug coverage, which is an essential aspect for many folks managing chronic conditions. The Advantage plans may also cover dental, vision, and hearing services, making them an all-in-one solution for many. On the flip side, we have the Medicare Supplement, also known as Medigap. These plans are designed to fill in the gaps in original Medicare. They cover some of the out-of-pocket costs that original Medicare doesn't, like co-payments, co-insurance, and deductibles. However, it's important to note that Medigap plans do not typically provide coverage for prescription drugs, dental, vision, or hearing. For these services, you'd need to purchase additional coverage separately or pay out of pocket. So if we're talking about extensive coverage in one neat package, Medicare Advantage seems to have the edge. But if your focus is more on managing the costs associated with the gaps in original Medicare, then Medigap might be the way to go. Let's also remember that coverage isn't just about what services are included. It's also about the extent of that coverage. Some Medicare Advantage plans may limit coverage to a network of providers, meaning you could be out of luck if your preferred doctor isn't in-network. On the other hand, Medigap policies offer more flexibility, allowing you to choose any provider that accepts Medicare. To sum up, the choice between Medicare Advantage and Medicare Supplement isn't a one-size-fits-all decision. It's about understanding your healthcare needs and financial situation, and then choosing the plan that best fits your lifestyle. As we can see, coverage can vary significantly between the two plans. Next, we will discuss the flexibility of each plan. Flexibility in a healthcare plan is important. Now let's compare the flexibility of Medicare Advantage and Medicare Supplement. Firstly, let's talk about the ability to choose your doctors and hospitals. Medicare Supplement, also known as Medigap, supports any healthcare provider that accepts Medicare. This means you have the freedom to select the doctor or hospital that suits your needs without worrying about network restrictions. On the other hand, Medicare Advantage, or Part C, typically operates within a network of doctors and hospitals. This means your choice may be limited to those within the network, although some plans may allow you to see out-of-network providers for a higher cost. Next, let's discuss travel coverage. If you're an adventurous spirit who loves to travel, or you split your time between different states, this is an important factor to consider. With Medicare Supplement, you're covered anywhere in the United States where Medicare is accepted, and some plans even offer limited foreign travel emergency care. Medicare Advantage plans, however, may restrict coverage to their service area, except for urgent or emergency care. Some Advantage plans do offer travel benefits, but it's not a standard feature. Now let's talk about restrictions. Medicare Supplement policies cover coinsurance and co-payments, giving you predictable out-of-pocket costs. However, they do not include prescription drug coverage, so you would need to purchase a separate Part D plan. Conversely, Medicare Advantage plans often include prescription drug coverage, but co-payments and coinsurance costs can vary. Furthermore, some Advantage plans require referrals to see specialists and prior authorization for certain services. In some, Medicare Supplement plans offer broad flexibility in choosing providers and robust travel coverage, but lack prescription drug coverage. Meanwhile, Medicare Advantage plans may restrict provider choice and travel coverage, but typically include prescription drug coverage and possibly additional benefits like dental and vision care. Flexibility is key in a healthcare plan, and as we've seen, each plan offers different levels of flexibility. Finally, we'll discuss the simplicity of each plan. Lastly, let's talk about simplicity. How easy is it to understand and manage Medicare Advantage versus Medicare Supplement? When it comes to healthcare plans, easy comprehension and management can make a world of difference. Let's dive into these aspects for both Medicare Advantage and Medicare Supplement. Medicare Advantage, often referred to as Part C, rolls all your Medicare coverage into one plan. It's like a one-stop shop for your healthcare needs. The enrollment process is straightforward and can typically be done online or over the phone. After enrollment, plan management is also quite user-friendly. Many Medicare Advantage plans offer online portals or mobile apps where you can easily view your benefits, find providers, and more. Customer service is usually just a call or click away, ready to assist with any questions or issues. On the other hand, we have the Medicare Supplement, also known as Medigap. This plan is designed to fill in the gaps in original Medicare, covering out-of-pocket costs like deductibles and co-insurance. Enrollment for Medigap plans can be a bit more complex, as it involves selecting from up to 10 different standardized plans. However, once enrolled, managing your Medigap plan is relatively straightforward since it works in tandem with your original Medicare coverage. Customer service for Medigap plans varies as these plans are sold by private insurance companies, but assistance is usually readily available. So when it comes to simplicity, both Medicare Advantage and Medicare Supplement have their pros and cons. Medicare Advantage may appeal to those seeking a comprehensive, all-in-one solution with user-friendly management tools. Meanwhile, Medicare Supplement could be a good fit for those who don't mind a bit more complexity at the outset, in exchange for coverage that fills in the gaps of original Medicare. Simplicity can make a big difference in a healthcare plan. As we've seen, each plan has its own level of simplicity. Remember, it's all about finding what works best for you, and that might mean different things for different people. We've compared Medicare Advantage and Medicare Supplement on several key factors. So, let's bring it all together. In terms of cost, Medicare Advantage generally has lower premiums but potentially higher out-of-pocket costs, whereas Medicare Supplement tends to have higher premiums but lower out-of-pocket costs. When it comes to coverage, both plans offer similar basic benefits, but Medicare Advantage often includes extras like vision, hearing, and dental. In the flexibility department, Medicare Supplement shines with its ability to see any doctor who accepts Medicare. Meanwhile, Medicare Advantage may require you to use network providers. Simplicity-wise, Medicare Advantage is a one-stop shop, offering all your health and drug benefits in one plan. Medicare Supplement, on the other hand, may require you to purchase separate drug coverage. Remember, the best plan depends on your individual needs and circumstances. Thank you for watching, and we hope this comparison has been helpful in your decision-making process.